Rehabilitation outcome measurement is essential to assess the impact of our work as physiotherapists on patients' lives and society. But it is challenging in low-resource contexts. This is also because many existing measures come from high-resource settings. We therefore conducted focus groups with 35 physiotherapists from 18 countries in Africa, Asia, and the Middle East on the barriers and facilitators to measuring rehabilitation outcomes. We identified 4 themes regarding outcome measurement: the user theme, patients and their families in their environments; the provider theme, which is physiotherapists and other rehabilitation staff; and the application theme, so the actual measurement tools and scales; and the structure theme, which is management and health system level. Participants discussed the difficulty of using scales with categories as a barrier for patients with low health literacy. Someone said, quote, "Often we have scales that are categorized. The patient has to show between easy, difficult, impossible. But sometimes the patient cannot choose if it is difficult or easy, even if these 3 categories are easy to distinguish." Unquote. Someone else suggested that constant interaction and feedback was important for these patients to better understand outcome measurement. Others proposed using simple measures such as smartphone photos to document change over time. Pictures can be very relevant for users and their families, and also for decision makers. Someone said, quote, "If the patient is able to be independent, like a clubfoot patient, they can be a completely normal person if they got treatment. And otherwise, he will be a beggar." Unquote. I chose this quote for the heading of our study as it shows how rehabilitation impacts on many levels. It can affect major life decisions and opportunities. Participants said that for decision makers with less awareness, outcome measures should illustrate how rehabilitation can make the difference between complete dependence on others and the ability to live a functionally and financially independent life. In resource-poor settings, it is crucial that measures are not only context-appropriate and relevant, but short and easy to do, because resources are so scarce. Often the outcome measures I have seen being used in low-resource contexts were complicated, and they didn't fit the context in terms of infrastructure or staff training level or patient health literacy. One participant said, quote, "We should prefer to give support or services for the beneficiaries in the waiting list rather than going to fill documents." Unquote. As we were analyzing the transcripts of this study, I came to think that, for example, a timed walking test can be a useful measure for all lower limb problems, regardless of cause or type, rather than many different longer or condition-specific tests. It can be used to compare over time between patients, conditions, and treatment approaches. It can be self-administered for a remote follow-up. All it needs is a simple phone timer and an area without distractions or obstacles. It's also relevant to patients' daily lives, as walking is a key function for many activities. That's just one idea coming out of this study, and I leave it up to you to take the discussion further. To conclude, participants agreed that outcome measurement is crucial for the development of the rehabilitation sector in their country, and they called for support on a structural level by managers and decision makers to make outcome measurement a standard and a routine everywhere.